You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with chiropractor Dr. Larry Arbeitman. Dr. Arbeitman earned a Bachelor of Science degree in kinesiological science from the University of Maryland at College Park and graduated magna cum laude from Logan College of Chiropractic in St. Louis, Missouri. Dr. Arbeitman is the founder of Upper Cervical Chiropractic of Monmouth, located in Marlborough, New Jersey, and has overseen more than 150,000 patient visits in nearly 12 years. He has become well respected within the profession, and most specifically, the upper cervical specialty. He routinely trains, teaches, and lectures nationwide to colleges, students, and the general public. He is currently an active board member for the QSM3 Upper Cervical Method. Today, he will highlight several of his key points from his book, The Gift of Hope, The Path to Healing Through Upper Cervical Care. Dr. Arbeitman is widely considered to be one of the top chiropractors in the country, and he is also a contributing member of our national network of industry professionals. Today, we're going to talk about a very important topic. What is upper cervical care? Hi, Dr. Arbeitman. How are you today?
Good morning. I'm doing fine, and it's great to be here with you, Liz.
Well, thanks for joining me. So, what makes upper cervical care a unique chiropractic approach, and what is QSM3?
Yeah, great question, and I think before we can get into the micro, like what is QSM3, I think for our listeners it's really important to define what chiropractic is, because I think there's a lot of misconceptions about what chiropractic is out there. And, chiropractic is a separate and distinct healthcare discipline that focuses on the body's inherent recuperative power for the body to heal itself without using drugs or surgery. So it's all natural. We don't put anything into the body. We don't take anything out of the body. And it's a practice that focuses on the structure, the spine, and how it relates to the function of the body through the central nervous system, and in the nervous system's role in preserving and restoring health. So it's really, really a unique method of healthcare. I don't think it's an alternative medicine or complementary medicine. It's really a separate and distinct model, just like dentistry is. Now, within chiropractic's kind of an umbrella term. There's lots of different methods within chiropractic. Just like in law, there's a bankruptcy attorney and a health attorney and a divorce attorney. Within chiropractic, there are subspecialties, areas of focus, and one of the areas of focus is upper cervical care. And there's probably an estimate of 60 to 80,000 chiropractors in the world, and there's an estimated 1,500 to 2,000 upper cervical doctors. QSM3 is one of 6 to 8 upper cervical methods. So we kind of have chiropractic as the big umbrella, then upper cervical care, and then QSM3.
And how do you know if someone's body is misaligned?
Yeah, and that's really what makes QSM3 really unique within the different chiropractic models. So even though we focus on the upper cervical spine, one of the common misconceptions is, so you only take care of necks. We actually take care of the entire spinal misalignment. We just do it through the upper cervical spine. And that's because the upper cervical spine neurologically controls everything down below. So if there was a trauma or an accident or an injury to the body, or multiple traumas, accidents, and injuries over time that throws the body offline, that's going to result in body imbalance. Those imbalances or misalignments in the body can be determined through a proper evaluation, such as just simply looking at someone's posture. Every day we take digital images of people's posture, and they're surprised to see just how tilted their shoulders are, twisted their hips are, the angle of their neck and their head. Of course, through a examination, we can actually palpate these misalignments, and oftentimes patients don't even know they're there until we actually touch them, and sometimes they can be quite tender because there's lots of little nerves within the spine. And then, of course, the most accurate and detailed way, and I think one of the things that sets upper cervicals apart are our detailed x-rays. We take digital x-rays from different angles that allow us to measure the misalignment of the spine to 1/100th of a millimeter. So there's no guessing. We know precisely where the person's misalignment is and precisely how to correct it.
Now, for a new patient, what is a typical upper cervical care treatment or adjustment like?
You know, that's another beautiful thing about upper cervical care because it is so gentle, it's oftentimes underwhelming. I think a lot of people, from what I've heard through the years, are sort of a little fearful or skeptical or scared to get a chiropractic adjustment for fear that it may be forceful or herky-jerky or twist and pop and crack. And one of the nice things about upper cervical care, and there are many, is that we don't twist, turn, pop, or crack the cervical spine. You know, the adjustment is done in a very comfortable position with the patient lying on their side, and we use the information gathered from their x-rays and from their posture to gently restore alignment to the body with a gentle touch on the side of the neck. And although I'm just oversimplifying it for the purposes of our conversation, most of the time the most common question I get when a patient comes off the table after their first adjustment is they'll look up at me and they'll say, "That's it?" And I say, "Yeah, that's it. Isn't that awesome?" And so the reason why it can be so gentle is because those top vertebrae in the neck that are so critical, they only weigh about 10 to 12 ounces. I'm a 180-pound man. So we can use mechanics, leverage, and gently start to restore alignment to the spine. You know, I've always said you can lift a car with one hand if you have a lever, if you have a jack. And this is really no different. And the reason why the effect of the adjustment is full body is because everybody knows that the spinal cord in the upper neck controls everything down below. So if we can restore communication at the level of the brainstem, the area where the brain meets the spinal cord, so that the brain can talk to the body and the body can talk to the brain, the effect of the adjustment travels throughout the body. Just like if a doctor gives a patient a shot of medicine in the arm, he's not an arm doctor. He's using the arm to get to the bloodstream, and then the effect of that intervention travels through the body. This is really no different.
And do all chiropractors practice upper cervical care, or is there special training for this?
Yeah, you know, as I had mentioned before, when an attorney goes to law school, they sort of get sort of an overview of all the disciplines of law, and then they choose an area of focus. When a medical doctor goes to medical school, they study all the different aspects of medicine, and then they choose an area of focus. And similar with chiropractic. You know, as we're going through our chiropractic curriculum, we're getting exposed to the many, many different methods and styles of practice that chiropractors employ throughout the country. And for me, it was a very personal experience because I had played football in high school, and back in the 90s, we were taught to hit with our heads. That was before the whole, concussion conversation had started. And so my neck was never right after that. And it was through upper cervical care that I finally got help, because I remember being in chiropractic school back 17 years ago, back in the year 2000, and I was getting some traditional chiropractic methods, and all those methods help thousands and thousands of people every day in our country. They weren't working for me. And I remember questioning my decision to even become a chiropractor. And I remember calling home to Mom and Dad and saying, I think maybe I need to make a career change here. And I was telling this story one day in a hallway of one of the classrooms to a young girl, and she said to me, before you do anything drastic like drop out of chiropractic school, why don't you go listen to this upper cervical doctor, Russell Friedman, speak on campus? And because I was open, I said, okay, I'll go check it out. And Dr. Friedman didn't speak. He brought 6 of his patients who told these miraculous stories of their recoveries, of their health recoveries through upper cervical care. And naturally, I was intrigued that these people left their lives to come speak to the students on a Wednesday night. And I went to Dr. Friedman's office, not as a student, but as a patient. For me, I knew immediately. Once he did the evaluation and the detailed x-rays and gave me my first adjustment, everything had changed. And from that point forward, I had asked Dr. Friedman, can I just shadow you? And I went to his office every Tuesday for 3 years straight to just absorb what he was doing. And I was so intrigued by the science, the measurements, the validity of the technique and approach, but also the fact that people were coming from all over to get this type of care. And so that was 17 years ago, and I never looked back. And to this day, I don't even know the young lady who told me to go to that Wednesday night discussion, and she has no idea how many thousands and thousands of people's lives she had touched simply by sharing upper cervical care for me. Because at the end of the day, this is what it's all about. For me to get onto this podcast, it's about to get this information to a sick and suffering humanity that doesn't even know this method of care exists.
And lastly, what conditions does upper cervical care help with?
Yeah, to answer this question, I think we have to sort of talk about what chiropractic is and what chiropractic is not. See, the practice of medicine is basically naming and treating, naming and treating. And so patients, we are all programmed that when something's not right with our body, a symptom or a sign, that we call a doctor and we get a name for it and we get it treated. Chiropractic works very differently. See, because chiropractic focuses on removing the stress and pressure within the nervous system to allow the body to heal and mend, we don't do a different adjustment for different conditions. Now, patients come with various conditions, but they get better because we remove pressure off of their central nervous system, allowing their body to heal and recuperate. Now, it's a very simple concept on the surface. I promise you it's not simple to pull off, but these are the type of conditions that have responded beautifully to upper cervical care. The obvious would be spinal complaints like neck pain and back pain and herniated discs and sciatica and stenosis. And then there's some that may or may not seem as connected, things such as headaches and migraines and fibromyalgia and vertigo and Meniere's. These are all conditions that have responded to getting pressure off of the brain stem. And then even symptoms associated with neurological conditions like Lyme's disease, MS, and Parkinson's. Now, don't mishear me. We don't treat or cure any of these diseases, but the patients who are suffering with these chronic neurological illnesses do beautifully when pressure is taken off of their nervous system. And the last group of people that we just need to talk about are the children. And you may think, why would possibly a child need to get their spine adjusted? That spine and that nervous system is growing and developing. And just like when my children popped their first teeth, my wife rushed them off to the pediatric dentist, not because they had cavities or toothaches, but because we didn't want them to get cavities or toothaches. And I even joked with my wife. I said to her, they're not going to keep those teeth. They're going to get new ones. But in actuality, they don't get a new spine. And the amount of stress and trauma that a young spine goes through from the birthing process to the numerous falls, bumps, accidents, falls off the ottoman and the couch, their spines need to be corrected too, because a lot of the challenges that we're seeing in adult spines can be stemmed back from traumas earlier in life. And so children, whether they're well or children, whether they have neurodevelopmental challenges, always respond beautifully to our gentle form of chiropractic care.
Well, thank you so much, Dr. Arbeitman. We know you're extremely busy, so I just want to thank you for your time and help today.
Oh, the pleasure is all mine. Thank you, Liz.
And for our listeners across the country, if you are interested in speaking with the doctor, please visit www.getwellnj.com or call 732-617-9355 to schedule an appointment. Consultations with Dr. Arbeitman are always complimentary. He has never charged anyone to sit down and have a consultation in order to discuss their health needs and whether or not upper cervical care may be right for them. And on behalf of our team, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading experts.
You've been listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.